welcome to what we hope is going to be a great evening with a lot of food for thought as far as issues and concerns about mental health and mental health care in India is concerned. And we have, as you see, and as Mr. Karthikeyan has introduced, we have a very eminent panel and hope to have a good discussion. So this topic itself, mental health challenges, we have heard Mr. Karthikeyan outline why this is a need of the hour. And with 10% of our population estimated to have some form of mental illness, and 12% of our child and adolescent population, again, thought to have some psychological distress of kind. So we are looking at huge numbers, and we are going to hear more from our panelists on that. So this topic is really the need of the hour, and we need a lot more discourse on this subject. And as he had mentioned, that mental health is not just the absence of mental illness, but also a state of well-being. And we are going to look at how well-being, mental well-being can be promoted apart from just looking at treatment of mental illness as such. And since there is a lot available and a lot more awareness that is existing today, a lot of awareness leading to a lot more choices, options in terms of treatment modalities. I think as general public, we need more clarity on what is going to be the best options for the kind of different problems that people are going to face. So I would like to now start the panel discussion, and we'll do it this way, that I will address one question to each member of the panel to just initiate the discussion. And we'll go around the panel and come back to another round of another question so that we'll get a better holistic way of going about it. So I would like to begin with Dr. Ram Subramaniam. And I think, with this huge numbers that we are facing of number of people suffering from mental health issues and the incidence and the prevalence rates that we talk about, how do you think that we as a nation, we as a society, or an emerging economy, the kind of lifestyle changes, how is it impacting people in mental health in general, and how is it as compared to other developing countries? What is the scenario in India in general, and how do we fare as compared to people in similar such societies?
So thank you, ma'am, for giving me an opportunity. Because this is one of the important, very sensitive topic. And also this problem is going to pose a major challenging task for any government in the coming years. In the mental health scenario of this country is very gloomy, and as our president has highlighted, 3% of the population is suffering from the serious type of psychiatric illness who are dangerous to themselves and who are dangerous to other people. I am not talking about the minor type of psychiatric illness. If you are going to involve the minor type of psychiatric illness, almost 30 to 40% need psychiatric intervention. And for such a huge type of population, you can calculate the population of our country, 121 million, and you can calculate 3%. So you can imagine how many people are need the psychiatric treatment, who are in acute need of the treatment. For such a huge type of population, if you come across the infrastructure facilities, again, it is a very gloomy situation. In our country, we have got about 42 mental hospitals. And again, the private sector, we have got about 20,000 20,000 beds. And about the manpower, in the entire country, we have got about 5,000 psychiatrists, 2,500 psychologists, and 1,500 psychiatric social workers. So, on one side, the need is more. The other side, the service is less. Why I am stressing this important point is, In the past 20 years, there is a silent revolution is going on in the field of psychiatry. All psychiatric illnesses treatable, curable, and to some extent it is preventable. Yet if you identify the illness very early, if you initiate the treatment very quickly, and especially if it is coupled with proper rehabilitation, I can boldly tell that the recovery will be total. But the sorry state of affairs is, most of the individuals, whether they are upper class or lower class or middle class, whether they are educated or uneducated, they are not aware of the psychiatric illness. And because of the ignorance, lack of manpower, lack of infrastructure facilities, a treatable illness becomes an untreatable. A curable illness becomes an incurable. An acute illness becomes a chronic illness. See, that is why I was very keen when Karthikeyan sir, when he mentioned about this program, I was very keen to attend this program because we want to sensitize the common public. After this seminar, if you are able to identify the illness, if you spread this message, if you are able to save at least one person, we are the most happiest person. So the awareness, it is the most important thing.
Thank you, Dr. Ram Subramaniam. I just move on to Dr. Prasad Rao. And, in any given society, we readily identify that there are certain vulnerable populations. Some people seem to be more at risk for mental illness than other people. And if you look at it, it is the children, the women, and the elderly, and each constituting a huge chunk of our population who are more at risk. So what makes these special populations more at risk, and are there some kind of protective factors or risk factors that make them? And can we identify them? Can our families learn to identify them?
Thank you, Sujatha. First of all, I wish to thank, on behalf of Indian Psychiatric Society, to Dr. Karthikeyan for inviting us to share with the elite of this capital the mental health issues, which I think already Karthikeyan sir has really brought out some of the things. Only thing what I want to start as the president of Indian Psychiatric Society. I also have to my left both who are presidents of past presidents of Indian Association of Private Psychiatry. Two important facts. First, the psychiatric services across the country, the total number is increasing. Psychiatrists are probably now reaching around 6,000, but majority of services are done in private, and if you take the ratio, it is 70 to 30. 70% of psychiatric services are given by private. Now coming to the three vulnerable groups which Sujatha has brought out, all the three are vulnerable for various reasons. First, the extremes of two age groups, the children and adolescent, which roughly form around 18% of this population of this. They are more vulnerable than others. And there are enough reasons to start with, apart from talking, the previously protected joint family system is no longer there. The family is now shrinking very badly. And among the shrinking, both the parents, if they are working, the time spent, the quality time spent with the child is gone. Today, probably a child would receive an iPad by the end of 1 year so that the child no longer disturbs the mother who has to do a lot of other responsibilities. There starts the less emotional interaction, and it starts with the growing up. As the child grows up, there are other pressures which come. The child is put into the school by the age of 2 years or 2.5 years, whatever the name of the school, play school, nursery, UKG, LKG. And the quality time and the play, which I think most of us sitting on this dais would have enjoyed during our childhood, we were forced to go and play between 4 to 6 by our parents. Now, most children do not have. There starts emotion. Then the competitiveness, the exam stress. Right now, as child, at the age of 10 years, is decided by the parent that he would join the so-called concept school, where he's pushed to either engineer or a doctor, because there are only two professions which parents, in general, I'm talking about a very large population, though I'm generalizing. There are only two courses, one is the maths course and one is the biology course, and they decide way back at 10th year. So these are the pressures of the day. In fact, that is one important reason why the suicide rates are maximum in the age group of 10 to 25 years. In fact, suicide has two different peaks in this two vulnerable group. We are talking about the child, we are also talking about the elderly. Then we are also talking about women. Now, women is now, today's woman is very, 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 I would say, encouraged to go and become independent, learned and all, but she also carries lot of other emotional issues which is going on in the changing society. And in general, women are more vulnerable because of their own sexual hormone state, which causes the mood changes. Now, I will take only 1 or 2 minutes to just explain the two important examples. A child who is doing very well at home but doesn't perform in the class is one child which is neglected. That's called specific language disability. This is as opposed to mental retardation. Mental retardation means they have some problem with the brain cognition. Here there is some specific problems. And the second important thing in a child probably is the ADHD, what is called attention deficit hyperactivity disorder. Coming to the geriatric age group, the most difficult age, 6.7% of population is above 60 right now in our country, and it's growing very fast because the life expectancy is growing. And this group, especially of 60, again to the change society, now it is more of an empty nest. Most houses, the children are well settled in either US or in some other place, the parents alone stay, and remember, above 60, a typical person average takes about 6 to 10 tablets per day. They are already prone to diabetes, hypertension, and comorbid medical disorders. Depression is one which comes there as you grow older. There are dementias. So if you keep on talking, there are enough, but women on one side, children and adolescents on another, and then geriatric, all are vulnerable in one way or other.
Thank you.
But I would like to end with a thing that, as already highlighted by Ram Subramaniam, I think psychiatry, when I joined psychiatry, we had only about 10 medicines. Psychiatry is a branch of medicine, and psychiatric disorders is the disease of the brain. So today, thanks to the technology, PET scan, MRI, you know very well, if a person reaches the hospital after chest pain within 6 hours, we can actually dissolve the clot. I wouldn't claim so rapid changes occurred in psychiatry, but today's modern psychiatry is much more beautiful in terms of getting the results. And one last point, the stigma when I joined in 80s, it was there. Today it is vastly reduced, but I still think that we should take the society forward in reducing the stigma of coming to us. In fact, children, very young children are being brought to us by the parents recognizing. So the recognition of the disorders and recognition of the care has further improved. Thank you.
Thank you, Dr. Prasad Rao. Yes, I think the stigma is finally seem to be reducing at different levels, and what you say is so true that even young children are being brought forward by their parents seeking help and counseling. That's a very encouraging pattern of perception of mental illness and mental health. So just moving on, I'd like to next address this to Dr. Rajesh Nagpal. Dr. Nagpal, we keep hearing about this mental health, mental illness is treatable. So there are words like treatable, curable, manageable. So there's a lot of confusion, I think, in the minds of people that what is treatable, what is manageable, what is curable as far as mental illness is concerned. And if you can throw some light on, you know, whether we have really come far, whether we are anywhere near curing anything, what are the kind of illnesses that could be treatable, curable, manageable, that would, I think, enlighten our audience and clarify these concepts a bit.
Okay, thank you, Sujatha. Mental illnesses per se are treatable in most cases, curable in about 5 to 7% of severe mental illness and about 20% of minor mental illnesses, and manageable in a good 40% of cases. The issue is that when a person comes to me for a severe mental illness the first time, a young boy of say 24, he's had a serious breakdown, he's going into psychotic illness, the illness is already 3/4 over. The brain has been changed completely in this illness, which has lasted at his house for only 2 days. The illness has begun sometime around the age of 12 or 13 years. When I begin intervening with my treatment process, the illness is almost taken out to its chronic course. That is our biggest challenge today. The second challenge is to identify them before the illness begins. And for that, a lot of research is going on. The other area is that when you start treating them, then there are modalities available in the Indian context, affordable context, by which we can promise that a person who is functionally not very effective in terms of taking care of personal hygiene, in terms of aggression, violence, can become manageable. With modern techniques of rehabilitation, even a person who's grossly disorganized, we can bring him to a level where he can start taking care of himself. Modern treatments today involve not just medicines, but specialized psychotherapies and stimulation therapies, which would mean right from the olden electroconvulsive therapies or ECTs to now RTMS, vagal nerve stimulation, transcranial direct stimulation, and a host of other techniques. So the future certainly is very promising. But remember that the first statement which Sujatha made was mental illnesses are treatable. In some parts, curable. In some parts, manageable. But essentially, a chronic illness requiring chronic care. What we do not know is, how do we not get mental illness? How do some of us face horrendous stress and yet not fall mentally ill? Our entire focus is on those who fall mentally ill. That is the next new promising area of work which is now going on. How people can manage to stay say in Kashmir and not get mentally ill there and remain completely fine. We do not know the factors which promote resilience.
Thank you. Thank you so much, Dr. Nagpal. We'll come back to some more on those issues again. My next questions are addressed to Dr. Avdesh Sharma. So, Dr. Avdesh Sharma has been very much involved in the public education platform and in the mass media. So I would like to know that, what would be the goals of such educational campaigns? Have we moved beyond the level of just creating awareness? Are there some specific strategies, some campaign directions that we need to give our public education program? Because I think this is such a vital part of any public health initiative, is to create public education. So what is this crucial role? And also, can we think of public education in terms of preventing and promoting mental health rather than focusing on only creation of awareness on mental illness?
Thank you, Sujatha. First of all, thank you, Mr. Karthikeyan and Belinda, who conceptualized this program. I think this question should have gone to Sujayaji when she was in the ministry. Yes, there should have been a planned focus. Yes, there should have been public-private partnerships. Yes, there should have been differences between different kinds of mental illnesses and how to early identify and how to prevent and how to promote health rather than prevent illnesses. It hasn't happened. And I think it hasn't happened because somewhere the public at large did not become a part of the whole movement. I think mental health is too important to be left only to professionals. Each one of us who's sitting here, including us, because we also at the end of the day are prone to, especially when you hear people out for 10 hours a day, prone to develop certain kinds of psychological issues. What do we do with what we see around us, and what do we do when we have our own negative emotions, should have become a part and parcel of right from childhood as a way of living, and not beyond when somebody has fallen sick. As Rajesh pointed out, that if we are able to pick it up early on, which means very early you are able to help a person, the long, over a period of time, kind of disabilities that happen to people. And I'm not talking about disabilities only emotionally, although that's the biggest one for the person and the family, but in terms of the man days lost, in terms of economic, in terms of financial, in terms of occupational, physical, because now we are seeing a large amount of interface between physical illnesses and mental illnesses, and interpersonal. If you actually were to see the word healthy, it comes from heal thy, which means right from the beginning, if we want to prevent illnesses at one level and make people feel the sense of well-being, which is an essential part of the WHO's definition, then that can only happen when you empower the people. Now, at this point of time, I think we are empowered enough, although I think that in terms of the amount of resources that are available with new technologies, we have the latest movie which is not even released somewhere across the world, but we don't have basic mental health issues or basic health issues. Out of 800 channels that are there available on any of the platform to the television viewers, only one is struggling to survive, which is having only health content, a channel called Care. I think as a public broadcaster, Doordarshan did an excellent job. There were some other channels also which carried it out. But today we have cell phones. There are 900 million cell phone users in this world, in this country. Internet is available to almost 350 million at this point of time. Newspapers and digital forms of it is available on the net. So if we were able to just manage this content well, which means in a layered way, empower people to be able to recognize their mental health issues, number one. Guide them to be going to the right sources. We keep talking about only 6,000 psychiatrists, 2,500 psychologists, 1,500 social workers, but we have a vast force of doctors, of physicians, who have not been trained in mental health issues, if we were to take them along. We have more than 6 lakh Ayush workers who are there as a resource, if we can take them along. We have empowered teachers, we have empowered spiritual leaders who can be taken along. And for a large number of people, you do not require extremely sophisticated services. So what can happen if we were to move better as a society is in a tiered way, if we can have people access the services which does not require any rocket science, and then only when they become slightly more disorganized, and incidentally, as Rajesh was saying, that there are stages, and when they see us, they are already in a disorder, but before that there is a stage of dis-ease, and before that there is a stage of distress. So if you were able to pick it up and help people to recognize it, I think that in future, in terms of community psychiatric services, will be what is required. At this point of time, unfortunately, we have lots of people who are in the media. We have talks about public-private partnerships, but that hasn't happened on the ground. And if we were able to do that, possibly in next 5 years, we would be able to take a quantum leap, because if we don't do it in next 10 years, we are doomed as a society.
Thank you. I think continuing from there, and the use of public education forum to drive dispelling myths, demystifying mental illness, we'll come to stigma, and I would like to address this to Dr. Belinda. We hear so much about the word stigma. I mean, we as professionals are also stigmatized as much as seeking help is stigmatized. So how do we deal with this problem of stigma, and what kind of community action, the work of civil society, how can they all come together to deal with this huge problem of help seeking, reluctance to seek help, reluctance to visit a mental health professional, and deny the problem itself to a large extent till it's absolutely.
Okay. The last 30 years I've been working on the issue of social discrimination, be it with caste, be it with identity of gender, and also for 19 years I was practicing in Madurai, and I used to be with Dr. Ram Subramaniam, in private practice, counseling. So, first of all, I would say there is really a serious issue in India about health-seeking behavior. I think a few of the speakers already touched. People do many things before they go to a professional for help, and actually more harm is done. Just 2 days ago, I was talking to a very well-educated family having a person with bipolar disorder, and they've been taking this person around for religious, ritualistic kind of treatment. And when I asked the father and mother, they said, this is to do with spirits. They very deeply believe that it is to do with the spirits, and they were saying every time there's a full moon day it's happening. And I know for sure that is not true, but they are having their own correlations. So health-seeking behavior, I think Dr. Avdesh already mentioned. So therefore, the public too know about the issues. The second is, human beings are, we are very strange animals. We can be extremely empathetic, or we can extremely discriminatory. Both coexist, we do not know. Like you see the refugee crisis in Germany, I saw a BBC, many people are putting up tents, welcome to refugees, very deeply empathetic and understanding. And there are people protesting, they don't want to have refugees. So this human behavior is very much part of who we are. So therefore, how do we build empathy towards? So therefore, public programs, public discourse, to clarify myths and misconceptions about mental illness is very much important. The third thing I would say is about what we are ashamed we hide, is it not? If you are ashamed of something, we hide. That's again linked with empathy. Very often I have noticed people do not want to seek help because they are ashamed that this has happened to their family. I think earlier Dr. Prasad or Dr. CRS mentioned, you may have money, but you feel, oh, I can do anything to cure my child. But unfortunately, you are not, because you are so ashamed this has happened, you are not seeking help. So this is also something, how do we empathetically, communicate this message that it is treatable, manageable, curable. I think it has to go to schools, colleges, where the high-risk population, we think, because they are undergoing a lot of stress, like Dr. Prasad said.
Thank you, Dr. Melinda. Dr. Sujatha Krishnan, you've been in the government for so many years and been a part of a very important Ministry of Health and Family Welfare, and a part of many initiatives driving the National Mental Health Program. Now, we know that the National Mental Health Program, initially the way it was conceived and started way back in 1982, was quite a bit of a failure, disaster, and it didn't really take off. And then there was another later version. So, have we really moved beyond that? Have we achieved any milestones? What are the government initiatives today to address this huge population, the treatment gap between the resources and the need? So you could probably enlighten us and give us some hope about what the government can be doing.
Yeah, I think it's thank you, Dr. Sujatha, for a very relevant question. And as everybody said, thanks to Dr. Karthikeyan and the foundation for bringing this important topic. But as I look at the audience, what I always say, mental health issue is not part of the psyche of government, whether it's at the central or the state level, or of society at all. So this is something that actually worries me sometimes. And at the same time, I find when, such initiatives come up, there is hope. Yes, you talked about the National Mental Health Program. Well, it was started in 1982, much before, I think, that must have been when I was just about to get into service and things. And many years down the line, when I came into the program, I remember within the first meeting, and this was said, oh, mental health program, usme kuch nahi hota. I was totally zapped. I was wondering what is it that I've come to head here if nothing was happening. But if you look at the history, how it was conceived, I think there was a vision. Yes, it was to provide basic treatment to people within community settings. There was also about the whole effort. I think that vision was right because there wasn't anything much. Like, I mean, we can talk about the stigma, we can talk about the awareness not being there. And in 1982, I think it started as a little experiment, and there were just 4 districts that were chosen out. And that was much later in 1996, you know, when it was to come. But when the program was conceived, the DMHP was supposed to, that is the District Mental Health Program, was to be part of that to this thing. And I think all of us realize if something, when we say mental health is treatable, I believe in that. This thing, and it's a challenge. There's nothing like, and if you want to be in this sector, you need to have oodles of courage to be in and to be quite passionate about it, to bring in the people to do that out. But when it started as just 4 districts, and if you will see over the course, I think in 2002 it had gone to about 27 districts, then in the 11th plan, 100 districts. Today with the 12th plan, we are just in 241 districts. And I think that speaks volumes for the kind of effort that is going on. And if we say in a population of 1.2 billion, we can have just a program in saying. Although the 12th plan, but I must also say the other part of it. Because when I was saying, I remember the figures, we looked up as saying, I Google searched, I did everything, I looked up at the MCI figures, which says it's only the registrations. But the fact is that at that point of time, we had roughly about 3,800 psychiatrists. But this country generously gives away to UK, Australia, and Canada. The rest go there. We do not have. As far as if you talk about the shortage, it is the shortage of psychiatrists is more than 66% in this country. The shortage of clinical psychologists, psychiatric social workers is more than 90%. If you talk about psychiatric nurses, yes, it is a little better, 50%. So that is the kind of thing saying. But then the question comes, do you need this whole setup to do it out? There have been talks about, you know, ASHA trying to recognize a thing. The ASHA is overburdened. I don't think the ASHA is the person to do it. I'm a woman, I have spent years in education, and I think, you know, we rob the girl child of the childhood. We are robbing the adolescent girl of adolescence here, you know, and trying to sing. The ASHA cannot be, the ASHA is supposed to be the superhuman doctor who's, you know, trying to do everything. You know, and also to burden. Mental illness is treatable, but the whole issue is about early identification, early detection, bringing it to this thing, and can we give it in community settings? So are we thinking about it? Are we speaking about it? So this is where the steps in the 12th plan, if it is actually, as I hope it will see the implementation, states are partners in that. And if this infrastructure, its money is not this thing, you need. But where are we going to get the psychiatrists? See how many people are going to venture in. In fact, I remember these debates with the MCI, we wanted, you know, them to introduce this. This has been there, you know, to start, you know, keep making MD in psychiatry. That's not there. See, how many seats are there for MD in psychiatry? Why don't we increase that out? We need to have. So we need to get the MCI on board. We need to get the Nursing Council on board. We need to have the RCI on board, the related ministry. I was very happy when you made this point. See, mental health is a thing, but every person with mental illness is not disabled. But we have to understand that this thing, that in those episodic moments when they are there, you know, when they have that disability, they must get. That has been my battle with the Department of Disability, where we included, so that the persons living with mental illness are not deprived of their rights and get the benefits that are required. But at the same time, we should try to avoid seeing that they are not labeled disabled. They are an integral part of society. If, see, today I have a mental health problem, I may be depressed, but I can be cured. If I have a heart attack, I will be disabled for some time. But it does not mean that I would have to be labeled disabled. No. So this is what we'll have to fight out, and that is the whole issue of destigmatizing. The other issue is about suicide. Now, suicide is often treated as a law and order problem. The person is, no, you don't need an arrest. The person who's attempting suicide needs treatment. That is what the whole issue of decriminalization of suicide, changes in the Indian Penal Code, that is very necessary. The Law Commission is saying, and it's happy that, within the current bill, which when it is passed, we hope to see that this will happen. So the emphasis right on trying to create, the centers of excellence where you will have these MD seats there. In the 4 subjects of, whether it's clinical psychology, clinical, psychiatric social work, psychiatric nursing, which is very necessary, and psychiatry itself. MD seats in psychiatry have to increase. You need to have people saying. That is where the people will come from. And yes, partnership. Now, you were right in saying that, when the government, when it started out, probably did not do. There is much more treatment happening outside the government sector. Everybody is not going into this thing. So you need to build those partnerships, and that is where they can play a role in trying to do the trainings and trying to do away with the desegmentation, where desegregation which has to happen, inclusion which has to happen. There is the whole lot of vulnerable groups. We are not also, see, we haven't touched the destitutes, the homeless, the orphaned which are there, people in emergency situations. Take Uttarakhand, which we had. There is problems. Or even in a major program like, Government of India spends so much on mother and child program, which is the focus. We need to. That's why today more babies are living, we have a say. But who talks about postpartum depression? Do we address this issue at all? We would say, yes, it's a part of, ki hota hai. But that's not hota hai. There is an issue. Can we discuss about how do we look at the mental health, integrating it with the general health care and with other related programs? This is something that we'll have to work out. I think
Thank you so much, Dr. Sujay. I think there is so much passion in your plea of wanting to improve things. And I think you've given us some hope that government initiatives are on.
Yes.
They are going to take some time to probably get the kind of results that we are looking for.